Thanks, Kelsey. Welcome, everybody. I appreciate you taking the time out of your busy end of the semester, end of school year calendar to join us today. To give you an idea of what we'll cover, we're going to talk about creating confident caregivers. So we need to understand who those students are that are going to become these caregivers, and we need to understand the patient population that they'll be taking care of. So we'll touch on both of those topics. We'll talk about some tools that Realityworks has to offer related to geriatric training for your students. And then we will actually take a look at a couple of these products in real time. And as Kelsey mentioned, we will finish the session with question and answers at the end. So again, who are our students? We need to understand how they learn, what they're typically like in order to really teach effectively. And then we need to understand the special needs of the geriatric population to be able to tailor the content that we're delivering to our students to really serve that patient population the best. So we'll start by looking at who today's students are. So Generation Z is where 51% of students fall right now. And they differ from millennials in significant ways. They're different in how they learn. They're different in how they view the world. So millennials were born in a world without the prevalence of social media platforms and computer technology. I can remember not having a cell phone. But millennials, like, those in that age range, witnessed the evolution of technology. While Generation Z, the students that we're addressing now, they were born and raised immersed in this technology. So digital natives is kind of an often used phrase. The difference is a double-edged sword. On one hand, Generation Z seems to be experts in the technology to the point that they need minimal management. However, on the other hand, their generation is characterized by a lack of concentration, which is deeply affected by smartphones and social media trends. We're going to use that word relevance over and over. More than ever before, these students want to see the relevance in what they're learning. So why are they learning what they are? How will it apply to the real world? How will they use these bits of knowledge and these skills that we're trying to teach them in the jobs that they expect to have in the future? So it's important to note that, again, the shorter attention span, the better technology skills, and the even stronger desire for real world learning sets Generation Z apart from our millennials that we're used to teaching. So here's a chart. It's, I hope, easy enough to read on your screens, but again, you'll get these slides in your email in the next 24 hours that can help. It shows a descriptive comparison by generation and learning preferences. And of course, these are generalizations, but they do give some nice differentiators between the differentiations of the generations so that you can understand how to tailor the teaching in your classroom to address these people. So if you have these all Gen Z students in your classroom, you're going to tailor your teaching methods to the things that we're seeing in the column for Generation Z. If you have a mix between Gen Y and Gen Z, then maybe you're going to kind of blur the lines and try to do the best of both worlds for those two different classifications of students. But this is a nice visual that helps you understand what those trademarks are for each of those different generations. So how do you teach Generation Z? Give your students more than just the textbook. We're not interested in reading. These people don't want to read. They want to get to the point. They want to understand it and apply it in as small a time as possible. We understand that didactic information is absolutely necessary and they need that foundation before they can apply it. But anywhere that you can add in group work and activities, that is fantastic. We know that PowerPoint slides are not going away anytime in the near future, but chop it up in your classroom. Present some slides, but incorporate different active learning strategies within those PowerPoint slides to break up the monotony. Incorporate quizzes, incorporate activities, incorporate some hands-on demonstrations so that every few slides you're getting those students' attention back to the content if they tend to slide during the PowerPoint presentation. Another idea is to really seek out project-based learning opportunities like internships and work-based learning opportunities. So here at Realityworks, we believe 100% in providing interactive hands-on learning opportunities, and we hope that we have something valuable to offer for you today. So now let's talk about who the geriatric patient population that we're really interested in talking about today. Why is this so important? Why is making sure that our future caregivers are understanding and catering to our geriatric population? Well, the odds of them taking care of patients in that age range is more than likely if they're in any sort of active care institutions, so hospitals, long-term cares, assisted living, so on and so forth. People in the world are living longer. By 2030, 1 in 6 people in the world will be aged 60 years or over. And the US population today is older than it has ever been. So these are all reasons, the backbone for why our students, why our future caregivers need to really be focused in on understanding how they can tailor their care for the geriatric population. Another trend we're seeing now is that demand for healthcare jobs is growing. This is not news. We've heard about shortages in healthcare, especially since COVID, and the statistics that the U.S. Bureau of Labor Statistics report is really reflecting all of that information. We're projected to grow in healthcare occupations 13% in the next decade. So this is much faster than the average for all other occupations. So healthcare is where it's at. There's job security. There's always going to be opportunity for our students to get a healthcare job. This increase, that 13% increase in the next decade, is expected to result in about 2 million new jobs. And this is through 2032. That's pretty exciting for students who are really interested in getting out into the workforce. In addition to new jobs from growth, opportunities arise from the need to replace workers who leave their occupations permanently. About 1.9 million openings each year on average are projected to come from growth and replacement needs. This is not news as well. We've seen a lot of direct patient caregivers leave the profession in the last number of years, mostly due to the stress that COVID brought. So the job security, again, is always there for our students. So how can Realityworks help? We're going to walk through 5 different products that Realityworks has developed specifically for teaching about geriatrics. I'll talk about each product and then give some ideas for how each product could be used in the classroom. But just to note, this is not all we have to offer for geriatric training tools. If after our webinar, you decide to go mosey on over to our website, if you go to the product section of the website, there is a specific definition, a specific category that you can look at for geriatric training tools that separates out all of our geriatric items just for you to easily find them. So please note that. Okay, first is our Real Care Geriatric Simulator. This simulator is a wearable suit that enables students to experience the physical challenges like restricted range of motion, stooped posture, and joint stiffness, along with visual impairments like glaucoma and cataracts. This is one of the products that we will take a closer look at during the demo part of our webinar. And of course, we've included curriculum that includes 9 lessons on topics ranging from geriatrics and gerontology career exploration to visual impairment and declining mobility due to aging. So how can you use the geriatric simulator in your classroom? The possibilities are endless, actually. Perhaps start with a simple exercise like having students put on one of the pairs of visual impairment glasses and then try to read a page from a book or a screen on a computer. Have the students put on the weighted vest, knee immobilizers, and the cervical collar. With the use of the walker, have a partner go with them to attempt to go up and down a flight of stairs. These types of immersive experiences are very powerful for students to experience. They often report a variety of emotional responses to the experiences that stick with them over time. And that's what we're always looking for as teachers, are learning experiences that leave an indelible imprint on our students, learning experiences that they will never forget. In addition to the experiential portion, have your students start to think about how they would tailor their care for each patient with those issues in mind. For example, if their patient has glaucoma, now they've experienced what that's actually like by wearing the visual impairment glasses that simulate glaucoma. Now they can start to think about what they would do differently if they were the nurse or nursing assistant working with this patient. It's never too early to get our students to start thinking like caregivers. Our next product is our Geriatric Sensory Impairment Kit. This is another great hands-on tool for building empathy towards older adults. It uses 3 interactive components to help students walk in the shoes of older adults. A hearing impairment simulator, which lets the user experience tinnitus, some people say, high-frequency hearing loss, and general hearing loss, and dementia-related confusion. It also comes with a geriatric arthritis simulator that simulates moderate to severe arthritis, as well as a geriatric tremor simulator, which uses EMS technology to induce hand tremors. This, again, is a product that we will have a chance to look at more closely in the demo portion of our presentation. So ideas for a sensory impairment kit are similar to ideas for using the geriatric simulation suit in your classroom. Give students the opportunity to see what it feels like to have arthritis, a tremor, or a variation on a hearing impairment, and then have them complete different tasks. Have the students put on the arthritis simulator and attempt to open a pill bottle or tie their shoes. Put on the hearing impairment simulator and have them listen to their partner say a sentence out loud. Then they have to write that sentence down on a piece of paper. It can be much more difficult than they would ever expect. Again, the next step would be for students to start to explore how they would interact differently with patients that have these limitations. How can they be effective caregivers to geriatric patients that have these types of challenges? Let's get them started thinking like caregivers early and often. Next is our geriatric skin conditions kit. This is a moulage kit that can be used on mannequins or standardized patients. Our adhesive washes off easily with soap and warm water, so they can be used over and over again without any bad residual on either you or your mannequins. This, again, is one of the products that we'll be looking at during our demo portion. So how to use these? First could be for students to document what they're seeing. Accurate and thorough documentation is always a challenge in practice. So giving students an opportunity to develop this skill while still in school is so valuable. Another way to use the kit is to incorporate a skin condition into a high fidelity simulation scenario. And maybe the skin condition isn't even the main focus of the scenario, but can add depth and realism. Maybe your simulation scenario, for example, is that a geriatric patient is brought into the hospital because their adult child that lives with them found them unconscious at home. When the students complete a thorough assessment, they find that the geriatric patient has a significant bruise. Now the students are dealing with a very sick patient, but also have to deal with the understanding of where that bruise might have come from. Our next product is the dementia simulation experience. This is another immersive experience that gives students the opportunity to experience the visual and hearing disturbances and the sensory impairment that are often found in geriatric patients specifically with dementia. The product comes with 20 sets of supplies, so 20 students can simultaneously be completing the exercises. The included curriculum explores 5 different types of dementia. For example, Alzheimer's, Lewy body dementia, and frontotemporal dementia. Oops, sorry, I'm getting a little clicky with my forward on my slides. I apologize for that. So how do we use this in the classroom? Similar to our other immersive experiential products, use this dementia simulation kit to offer students the chance to feel what it feels like to have dementia. It's likely that a lot of our students have a parent or grandparent who has some form of dementia. So helping them understand what their loved one is experiencing can be an eye-opening experience. Give your students a verbal list of 5 things they need to do once they have their equipment on. Have them report back on the challenges they had in completing those tasks. It sounds so simple, but I've actually participated in this challenge before, and it's shockingly difficult. I've been a nurse for many years, and I learned a lot from participating in this particular experience. Once they've completed the exercise, again, have them think about how they might interact with patients with dementia. What strategies can they develop to provide the best care possible? Our last product for today is our geriatric medication management simulation kit. This kit is another empathy building tool as it gives students a feel for what it's like to juggle multiple medications, as so many of our geriatric patient population does. Specifically, students can practice opening and dispensing medications while experiencing a loss of tactile sensation, as well as visual changes. The included curriculum helps students learn about the challenges and risks associated with managing multiple medications as a geriatric patient. So how can we use this in our classrooms? While wearing the visual disturbance glasses and the sensory impairment gloves, have students read the medication label, open the pill bottle, and prepare medications for the day. Repeat with all pill bottles. Have them create a schedule for taking the medication for the entire day, including considerations for medications that need to be taken with food, or medications that need to be taken on an empty stomach, or medications that need to be taken when the patient is about to go to bed. All of these considerations, along with the visual and tactile challenges, really provide an immersive experience for students to feel how complicated this really is for our geriatric patient population. You can also use this kit to begin the discussion with your students about how they can speak up when they have concerns about patient safety. What about their experience concerned them? The number of medications, the timing, the difficulty of organization. These are important questions to have students start to think about early in their education. Okay, so now I am going to stop sharing my screen, and I am going to show you a couple of these products close up so that you can see what they look like in real life. Okay, we're going to let the light adjust. I'm sorry, it's a little glary right now. Hi, I'm Molly. We're going to start with our geriatric simulation suit. So these are all the components that come with the suit that we talked about in the PowerPoint slide. So here is the vest, and it is weighty. So when a student puts this on, there's no other choice but to kind of stoop forward. It's the idea is to put the vest on or the other equipment on and give about 5 minutes for that feeling to really settle in before attempting any of the exercises that we have outlined in the curriculum. This way, it's not just a quick one and done. They have to let that feeling kind of sink in before they can participate in those activities. The beautiful thing about this vest is that it is one size fits most. And there is Velcro on the front where you can adjust the amount of weight that you want to put in the vest. So you can, if you have smaller students, you can take some of the weight out to make that easier for them. The kit comes with 2 of these ankle weights. They wrap around the ankle. And it comes with wrist weights that do the same thing. So these are just providing that extra push and pull on the body where it's a lot more difficult with range of motion. Maybe they have difficult washing their own hair. Maybe they have a difficult time leaning over, all those kinds of things, because this extra weight really hampers their range of motion. We have the cervical collar, so that can go just right around the neck to really impede the ability to turn side to side or to look down and see the ground in front of them, which happens a lot with our patients. We have knee immobilizers and elbow immobilizers. So again, these just prevent the free use of those limbs. So if you can imagine putting extra weight on your body, using a walker, and the joint immobilizers. And again, trying to go up and down a flight of stairs. It's not that hard when you think about it, but when you put this stuff on and you feel what it feels like, it's really can be overwhelming for our geriatric population. So when our students feel that, they can be like, oh my goodness, I need to be more patient when I'm walking with my patient because they have these things going on and I understand that better now. Here are the sensory impairment gloves. So again, put those on and try to count out some change or turn the pages in a book. It's really interesting what happens when you lose that tactile functioning in your fingertips. And then these are always kind of a showstopper for us. People love our visual impairment glasses. So this comes with 6 different types of visual impairment. It comes with retinal detachment, glaucoma, diabetic retinopathy, macular degeneration, retinitis pigmentosa, and cataracts. So you can see each one is tailored to replicate a different visual disturbance that when the students put them on, it really is a wow factor and something that really sticks with them. So that is our geriatric simulation kit. We actually had a school who decided to they owned this particular product and they decided to do a professional poster presentation based on their student experiences with the geriatric simulation kit. So that was kind of fun to learn about. Next is our geriatric skin conditions kit. And I have it set up here on our venipuncture arm. Of course, that does not come with the kit, but I wanted to show you what the moulage, the size of it, and how it actually looks when you apply it. Again, you can put this on your standardized patients as well as your mannequins without any harm at all. And it comes with a whole bunch of different skin conditions. So the one that I have here on the mannequin right now is shingles. So it just looks, they all look really remarkably gross. Benign and cancerous lesions, eczema, age spots, burns, lesions, bruises, dry skin, and thin skin. Comes with the wound bond. You mix the 2 pieces together in equal parts and then apply it to the moulage and then apply it to your person. Or your mannequin. So it's very easy. It takes about 10 minutes to set up. I just did this morning and it was no problem for me at all. So it's kind of a great way to increase realism in your scenarios. And again, you can see how big they are. They're made out of latex, or not out of latex. They're completely latex free. They're made out of silicone. So you don't have to worry about the allergy piece. But again, if we think about how difficult it is to accurately document these types of things, you can get your measuring tapes out and have them measure the skin condition and describe it in medical terms that they would put in a medical chart. And it's really a helpful learning experience for students. Okay, here comes my awkward transition period. So I'm going to move this particular product out. Thanks for your patience. All right, so we talked about the other types of immersive situations that our students really find helpful. So here is our hearing impairment simulator. So you can see it comes with the headphones, and then it comes with the controller that all of the different hearing impairment items that we talked about on the slide, you are programmable right into this piece. It comes with the covers that go over the ear pads for hygiene purposes, but this is a great simulator for people to try to understand how overwhelming some of these hearing impairment pieces really are to how people function on a day-to-day basis. So that's really a neat one. Next is our geriatric tremor simulator. So this comes with, I just have one set out here, but it comes with a whole bunch of different of the replaceable pads. And so there are instructions on how to place the pads on the arms and how to use the controller to increase or decrease the amount of impact to the arm that actually results in a visible and definitely feelable tremor for the person wearing the simulator. And having them have that tremor, and then again, being able to do simple tasks like counting money or tying their shoes or opening a pill bottle, the understanding of how much more difficult and complicated those types of simple, what we would normally see as simple tasks, while having these afflictions can be such a challenge for older adults. So being able to think about how you can help them overcome these types of things or what you can do to actually help them in that type of functioning is really, really helpful. Lastly is our geriatric arthritis simulator. And this one is a favorite for students. So there's a right hand and a left hand, and it looks kind of barbaric, actually, this contraption. It's not so bad, though. You have Velcro items here that wrap around the wrist. So you slide your wrist in, and then you slide each of your fingers into the holes. And you tighten it over your first knuckle. So then you end up with this piece on, and it really limits that mobility. And actually, it's kind of uncomfortable, like arthritis actually would be. And so having students feel what it feels like to have arthritis, which is so common in our geriatric population that sometimes it's kind of downplayed, like, oh, yep, they have arthritis. What else is new? Everybody has arthritis. But again, open a pill bottle, write your name, write a check. I know nobody writes checks anymore, but sometimes our geriatric patients still do. So how does it feel to have to do those tasks with this somewhat uncomfortable contraption on your hand? So students love this. Again, super sticky learning opportunity for students to get involved with. So that concludes our demo portion. So I'm going to go back to sharing my screen. And we will chat about some other things that Realityworks has to help you. We have something called our Geriatric Program Implementation Guide. And this is a visual of this. It's a great document that will show you how you could set up your classroom to teach geriatric content to your students. So the first page is an actual suggested layout for a classroom of different products that we have available and how you might set up stations in your classroom. That second page is actually a lesson overview of all the content that's included with each product that Realityworks offers. So we will include a link to this document in the PowerPoint and in the email that you will receive with the recording of this webinar. So I hope you find that helpful, even if it's a matter of just inspiration for you to get ideas of how different topics that you could cover in your own classroom. I hope it's helpful for you. All right, so now we are done with our formal presentation and we're ready to answer any questions that you might have. So I'll turn it over to Kelsey, to let me know if there's anything in the chat.
Yeah, a couple of questions in the chat. First question, can you purchase just the visual impairment glasses?
At this point, the answer, unfortunately, is no. It is part of that entire simulation kit with the other wearable components.
Okay, awesome. And then another question, for the geriatric sensory impairment kit, does it come with one of each of the simulators in that kit?
That is correct, one of each.
Okay, perfect. And what classes would these simulators be beneficial for?
Oh my goodness. Really lots of different classes. You could use it in absolutely your nursing assistant classes, your medical assistant classes, your any foundational health science, even before they decide what kind of health science field they'd like to be in. It really is across the board. Nursing classes, even sports medicine, if they have, some sort of leaning, pickleball is super popular. So maybe they have some geriatric pickleball players that they're responsible for. So really a wide variety of different classes that it can be used in.
Awesome. Perfect. Well, I don't see any other questions at this time, Molly.
Great.
So now what? So Molly did go over our geriatric program implementation guide. So there is a link to that. If you are interested in speaking to a account manager regarding any of these programs, you just want more information, you can click on that free form. Otherwise, I will have another slide that you can scan and you will be connected with an account manager to discuss any questions you have or anything in further. We also want to point out we have a teacher appreciation giveaway going on right now. So that link will lead you right there. It's free to enter just to show our appreciation for all those teachers out there. And once again, if you do have any questions, contact us via email, or you can request a consultation. On the next slide here, there is a QR scanner that you can scan, and it will ask you a couple questions, and then we will connect you with your local Realityworks account manager, and you'll be set to go. So thank you guys so much for attending our geriatric webinar. We do love putting these on, and I hope you have a great rest of your day.
Thanks, everybody.